Okay, hello everyone. Welcome back to today's session organized by VODAN Africa and Asia. Happy to see all of you in this meeting. So my name is Putu Hadi, and our agenda today, there are 7 agendas today. The first agenda is update from access and control. I will update about that. And the second agenda is update of the localization Monday group. And the third agenda is a template group from Alia, and will be followed by research update on research data inclusion in CEDAR by Dr. Miriam. And the next agenda is update of the machine learning and dashboard group by Rudwan or Dr. Sakinat. And the sixth agenda is update of the country coordinators about template creation. And the last agenda is update from the special issue, and the last one is about a question and if any other business that want to discuss in this meeting. So as always, try to keep our mic muted during presentation to prevent background noises. If you have any question while the presentation is going on, please type them into the chat box. So I will now hand over to Professor Francisca to lead the session. So, Professor Francisca, the floor is yours.
Thank you, Putu, and good afternoon to you and everyone. Welcome. I apologize for the brief delay in starting late. We had the channel hosting another very important program on the crisis in Ethiopia, so we needed to yield to them. If the next edition of the program is going to probably encroach into our meeting, then we may host our Tuesday meeting on another channel, which Putu and Aliyah will let you know. You're welcome once again. Aliyah, Putu, can you please post the full agenda on the chat?
Sure.
Yes, I can refer to that while I try to get my own copy up here. Where's the Tuesday meetings? I think the first update for today, as usual, we're going to be having our updates from the different sub-teams of our technical teams. And then we also have a very special update. We have been talking about data production on healthcare data, but then we also have a data production project on research data being executed by the Tunisia team. So today we're going to be devoting a greater part of today to receiving the updates on how far the project has gone, and then we can ask questions and provide suggestions to also assist the team of Professor Mariam and Zora and the rest of our Tunisia team. The first update will be on access and control meetings of Mondays by Putu. Putu, would you like to take the floor to provide an update on the access and control group? Thank you.
Yes, thanks. Yes, thank you, Prof. Francisca. I will share my screen as always to share my summary of access and control update. So yesterday, as always, we discussed about access and control progress, and this is the overview of access and control progress. So from Uganda, Mariam has a plan to meet with 3 data stewards this week from Holy Innocent, Lianto De, and Kitofu. And also she will meet data management person from Case Clinic to ask the first round of question. From Kenya, first round question answered by Zambezi and Beacon Hospital. So right now, William finished with the first round question from these 2 hospitals. And William also sent me OPD from the biggest health facilities in Kenya. And data steward from Zambezi and Beacon are ready to involve in the project. From Zimbabwe, no further update from Kuda, and today I contact Professor Bernard, but still no reply from him. I will keep up. I will follow to Professor Bernard tomorrow. And from Somalia, first round question answered by 5 health facilities. And from Nigeria, Abdullahi still processing the approval letter from the ministry. And Nigeria team raising issue about the agreement of health facilities and VODAN Africa. And also Din Jamal also asking the agreement of, but it is not necessary for health facilities, but for the level of government. And the last country is from Ethiopia. first round question answered by 17 health facilities. So with 3 health facilities left, but Ephraim still collecting the rest and the rest answers, because I still got the part answer of the first round communication. But we have another team that will involve in this access and control. But Alia and I will give a short explanation tomorrow about from Liberia. We will discuss with them first to make them know about what happens in access and control and what happens in Alia in vocabulary creation side. So next week, team from Liberia will join us in access and control and also vocabulary creation. And for the next step, so the next step is still same plan. So first, to continue to communicate with the health facilities that still not contacted, and continue to cover more health facilities. And the second plan is to move to the first round of communication topic list. And the third plan is to the country that finished the first round of question. So the country team should check the second round of question and discuss with me about what kind of like to make a better understanding about the second round of question before moving to the second round of question. Like before moving to the conversational session with the health facilities. So that's all from me, Professor Francisca. Back to you.
Yeah, thank you very much, Putu, for the progress made by the team which you lead. Perhaps we're still going to hear from the country leads later to know if we're actually still good with the number of health facilities for each of the country, because there is one thing to make contact and then let us know which of the contacts are now concrete and then ready to proceed to the next level. Last week, I had made a promise about working on the budget, and it's actually the number of having the finalized list of health facilities is one of the things causing delays in finalizing the budget for each of the countries, because we already have the budget allocated for each of the countries. But then if there is a need for us to revise the budget based on a revision in the number of health facilities, this may come up, but that is all right. Thank you, Putu. Next, I'm going to invite Alia to give the update on the localization meeting of Monday, and that will be followed by the updates on the template creation group for the 7 countries involved in the health data production. Alia, please.
So hi everyone. So basically I will start from the CEDAR localization meeting that we had yesterday. So basically technical team, specifically Getu and Samsung, are deploying the CEDAR embeddable editor, and also now we have 2 options of deploying CEDAR. So the first one is CEDAR embeddable editor and components that are dependent. So basically this is the first option. Then the second option is full CEDAR system architecture. So now we are also trying those 2 options, and basically the first option is already in place. Specifically, there was a dependency on terminology server, which was resolved by the CEDAR team, and now Geto and Samsung were able to deploy it. So this is basically from yesterday's meeting, and we also had discussions based on those 2 options, what kind of option is best for instance, for VODAN institution and health facilities. And then we discussed also pros and cons of these approaches. And that's it. I don't know if Samson or Geto would like to add to this summary anything. Samson, Geto?
Yes, Alia, this is Samson. I think you well summarized it. Thank you.
Okay, great then. So, and then, so we also decided to have, a technical meeting team running weekly, so we can trace what we have. So basically, and then plan things during the meeting. So this is going to be very helpful in terms of deployment, and all technical people within the team so can also deploy CEDAR in their local machines and also can run and practice with that, so everyone can contribute from their sides. So this is the summary from yesterday's meeting. And also, if I go to the template creation, then on Thursday we had a training, so where most of countries showed like demonstrated their OPD templates. So basically most of them are ready, and I also still receiving some OPD templates, including the vocabularies. So far we have OPDs of Uganda, Ethiopia, Tanzania. So basically for Tanzania, it's this case report. So, and then we have Liberia, which is going to be, since they joined late within the project, so we're going to have a separate meeting tomorrow with Puto and Liberian team. So we're going to discuss how we're going to work further on this one. So, and then we have Somalia. So Somalia is also in place. So and then Zimbabwe. I haven't heard anything from Zimbabwe, so from Kuda. So I hope that he will reply very soon. So basically, this is it.
Professor Francisca? Can you hear me, Alia?
Yes, we can hear you, Putu.
Okay, I thought. Okay.
I don't know. Francesca is there, I guess. Just go on with the next one.
Yeah, okay. Thanks, Alia, for the update. So now we will move to the next agenda. It is update on research data inclusion in CEDAR by Dr. Mariam. So please, the floor is yours, Dr. Mariam. You can present.
Thank you, Puto. Hi, everyone. Good afternoon. So please, can I share my screen, please, Puto?
Yes, you can share your screen.
So today I will present the progress report of the Tunisian project. And as a reminder, the purpose of this research project is the verification of data related to the impact of COVID-19 crisis on the migrants hosted in Tunisia and coming from sub-Saharan countries. So at first, and waiting for the fulfillment of the process of the verification of this data, we tried to make data available as an open data through the platform of the humanitarian data exchange, as you can see in this in the screen, as it was recommended by Professor Miriam. So for this, we created an account, but when we looked to share our data, the platform suggested to create an organization, as you can see here. And when we request for a new organization, unfortunately, we received an email that indicates that the platform gives only the possibility to access to some datasets and not the possibility to host metadata for datasets. So I don't know for this point, do we have to make some proposition about this? So, but however, our people can access or can ask for access to our datasets through the FAIR data point that was created previously and hosted in the website of the University of Sousse. And as you can see here, we have just to click in this and to ask to the access through this button, and then we will have to send an email to ask for this access, especially for some condition. That is the first just update for the opening access of our data. Now let we move to updates concerning the CEDAR templates and the creation of vocabularies. And just as a reminder, we have to create two types of templates on CEDAR. The first one for the research project and the second for the research data. Let's start by the research data. And in our case, we have to create vocabularies related to the interviews and to the news articles. As you can see here in BioPortal, we submitted ontologies. Just so we have the migrant ontologies, and we specified this in classes and in properties. For this, previously, we created an Excel sheet according to the recommendation of the group of VODAN data stewards. That is the step of the creation of vocabularies, and we can distinguish the classes and the properties. Now, when we move to the CEDAR platform, we have to look to the templates that we created. The first one is related to the news. And we created the whole template, and we linked it with the ontologies and classes and properties from the BioPortal. I can populate this for example, I have to specify the type of event, if it is related to security or health or social, etc. If it is health event, we can specify what type of health event, etc. This is the first template with the different section of this template. And we have the second template related to the interviews. And we can also populate it and see the different elements and fields of this template. We have just to make maybe some minor correction and to link with BioPortal vocabularies. So as I said before, we have to create templates related to the research data, and also we have to create a template related to the research project. As it was recommended also by Eric team, we can use an existing template which is entitled Improved COVID Project Admin. So this template will gather information about research project, for example, the title, the project acronym, and some information about the founders of project. So we have to make some changes in this template. For example, we have the element zone MV project identifier, which is an internal identification number to each of the founded projects related to zone MV. For this field, Eric proposes to use maybe Philips Foundation project identifier, because in our case, the founder is Philips Foundation. Also, we have, for example, this field, GUPRI stands for Global Unique Persistent and Resolvable Identifier, is another type of identification. And we have to create a specific one to our project. There are many tools that we can use. Eric proposes one tool, which is NanoBench. We have to explore it. And John also proposed another solution. Also, we have to explore it. That was the main updates from our side. And the next steps, maybe we have to look to the bulk importation of the metadata, and also to improve this template related to the project research. That's all. Thank you.
Can I ask a question, Putu?
Oh yes, go ahead, Professor Miriam.
That's really excellent, Dr. Mariam. You are so, you know, you've kept on pushing right from the beginning, and this is really, really impressive again. I have a question. So these data relate to the vocabulary created in the ZON-MW research program on the 61 VODAN COVID, 61 COVID related studies, right?
Mm-hmm. Yes.
And so, yeah, 69, whatever it is. And then we have our own VODAN Africa tree in the vocabulary, right? So maybe this is a question also for Alia and Getu, but are we going to be able to connect between the two communities? Do we know that, or this is still a question mark?
It's still a question mark, Professor. If exactly, we have to look how we can link between the different projects, and we can maybe ask Eric for this.
Yeah. Yeah, so this is something that I just would like everybody in the vocabulary leadership to reflect on, and this is something that we can reflect on, one, and two, also I know that Eric will be seeking collaboration for the linking up of the community, so it will happen, but it will be interesting with Dr. Mariam to have our own sense or view on it if we have one. Thank you. Very excellent work. Really, really exciting.
Thank you. Thank you.
Yeah.
Thanks, Dr. Mariam. Do you want to respond this, Alia or Getu or Samson? Or is there any question from for this presentation?
Well, I cannot exactly answer now, but I think this is a good idea to think about. And then we can discuss and think about this one.
Okay, Alia. So who raised there is a rising hand from Society for Telemedicine and e-Health, or Wondimu. Do you want to ask something? You can go ahead.
Yeah, no, just this is really just I would like to congratulate Dr. Mariam. This is great job, and I think we have to also share this experience to apply in other setting also too, because this is a good opportunity to use, you know, the research data just using the fair data point application. I think just I would like to appreciate. Thank you.
thanks, Wandimu. Dr. Araya, do you want to go ahead?
Yeah. Okay. Go ahead.
Hello. Okay. My name is Magnus from Nigeria.
Oh,
I listened to Miriam, and she has done a very good job. It's just very fine. The vocabulary, the templates, the flow diagram, and everything she has presented. I just want to thank her. The chat is disabled. I could not chat, so that's why I have to call. Thank you very much.
Dr. Araya, you can go ahead.
Yeah. Thank you, Putu. And I'm really impressed with the platform and what Dr. Miriam has done. Wonderful job. Thank you also for sharing. I agree with Wondimu that I was thinking how we can apply to other research agendas as well. But I want to hear if there has been any challenge in the development of such platform, because currently we use other platform for collecting research data like RedCap, Open Data Kit, or other. And I would like also if Samson is available, because we work together for electronic data collection. And I want to hear more whether the platform that was developed by Dr. Miriam and her colleagues is somehow different from what we have been using in the past 5 or 6 years. Samson, maybe would you please join and reflect our experience on the RedCap, Open Data Kit, using like electronic data collection platform with this platform. If there is an advantage, it's really something that we have to learn this platform. And also from Dr. Miriam, how was the data quality that was collected through this platform? Thank you.
So thanks, Dr. Araya, and Professor Francisca chat in the chat box to Dr. Miriam. Could you also share the vocabulary in the VODAN 3 for the embeddable editor terminology? Wait a minute, Samson. So yeah, Dr. Miriam. Okay, yes. Then you can go ahead, Samson.
Thank you, Putu. I think the data collections tools that we have been using are electronic data collection tools, which use mobile applications for offline data collection. And those systems are robust systems for collecting data for research electronically, and they are being used globally. The only difference here is those systems, they don't, as far as I know, they don't use the terminology service as such, or the data that was being collected wasn't verified in the sense of not being machine readable. And the added advantage here is the ability to use ontologies and verification process and the likes. Thank you. Over to you.
Okay, thanks, Samson, for your response. Is there any question or comment before move to the next agenda? Okay, I think that's all. Thanks, Dr. Miriam, for the presentation. I think Dr. Regina said that thank you, Dr. Miriam. We can adopt your tool for similar data collection in Pumwani. So yeah, we will move to the next agenda. The next agenda today is update of the machine learning and dashboard group by Rudwan, but because Rudwan is unable to explain here, so is there anyone that is that T Esther or Dr. Sakinat? Professor Francisca, who can update about machine learning and
Yes,
dashboard
I
other
was
than?
expecting. Yes, Dr. Sakinat. If Dr. Sakinat is available, she's part of that team. She'll be able to provide an update.
Yeah,
And
please,
I
Dr.
was,
Sakinat.
yes.
Yes.
And then before Dr. Sakinat, on a presentation by Dr. Mariam, I see Dr. Reginald, the comment, which is excellent, because if you all will recall, our architecture, we actually have two architecture, and then we have a combined architecture. We have the architecture for the data production for health data, and then we have the architecture for data production for research data. Before we had the combined architecture for the production of healthcare data and research data. So Professor Mariam's project belongs to VODAN Africa. It appears we have been having so much concentration on what is happening in Nigeria, how many health facilities, what about data stewards and all that. So I'm going to be adding that Putu and Aliyah, perhaps you should also include updates from Professor Mariam in our subsequent meetings, so that it doesn't appear that we have forgotten a very crucial aspect of our project and our architecture. And then let us see if there are people within the data production for healthcare community, like Dr. Reginald, for example, who would also want to be part of the data production for research data. It would be good to actually expand that beyond Tunisia, to see there are other member countries of the VODAN Africa that would want to go into the research data production. We propose that for the GAIC network, all the universities that are members of the GAIC network. So it would be good for them to actually join and be part of that project at this early stage.
Samson, do you want to comment? You can go ahead, Samson.
Do you want me to comment on the dashboard?
Yes, absolutely, Samson.
Yes.
Any technical updates? Yes.
Yes, I think in relation to the dashboard, what we have done is we have identified that the technology that we are going to use and specifications are also being prepared. Like Getu has prepared a certain document which is essential for doing the dashboard, and Rudwan is also managing that dashboard team in a way, and we are going to have a meeting on Friday, and we also have set a timeline on which we are going to develop the dashboard, and the dashboard is going to be generic and as well as specific to each facilities, and which is going to be available on each of the clinics. And it's going to be developed from scratch, and everyone in the team is being actively working on it, and we are from different backgrounds, and we are trying to come to a certain consensus on how we build on it. And lastly, I'd like to thank you, Professor Francisca, for bringing the research data aspect of the architecture. It's in place, and where we keep on forgetting that, and I think it's good to also and Mariam has brought it today, so that is good. Thank you. Over to you, Putu.
Yeah, thanks, Samson, for the update from the dashboard group. So our next agenda is update of the country coordinators about template creation. Let's start from Dr. Wondimu. So please update about the templates creation, Dr. Wondimu. You can go ahead.
Sorry. Thank you, Putu. Thank you once again, colleague. So just to update the overall, maybe from your previous update, You have mentioned that 17 health facility, already 20 health facility, the first communication is done. Already, I think Ephraim communicate you and he's compiling the final data, and then he will share with you the 20 health facility first communication, and template is also already created for OPD, and also Tigist created the template for the ANC also. Maybe she will share with colleague, because at this stage just we are focusing on the OPD data. So now I think most of thing is is in the right track, and maybe the next step we are waiting for is just start planning for the training. So this is a brief update from my side. Maybe Ephraim and or Tigist may add a point if I didn't address some of the issue. Thank you. Over.
Yes, thanks, Dr. Wandimu, for the update. So for the next update is from Din Jamal. You can go ahead, Din Jamal.
Thanks so much, Mr. Butu. For us in Somalia, we have created OBD for governmental health facilities, and I think that's enough to the government health facilities. What we have a problem is that the private health sector health facilities, they have separate tools. So we are thinking to I have sit with the regional health office to discuss about how we can harmonize the tools, and then we have this ongoing discussion about if we can have one tool for all private health facilities. As here in Somalia, the private health facilities they work separately and they are not under control of regional health facility. So we have a discussion to have a harmonized tool that we can use for FED data project, VODAN project. So in that regard, I think within this week we can have a clear picture what we can do, what is way forward, and then I'll get back to you if we agreed to create a one template for all clinics, and then if we agreed to have one standard tool for all, we need even to print for them that tool for us in order to have the data that we need. So that's the quite challenging, and I will keep post you in the next week meeting. But I will try my best to handle that in best possible way. And the other thing that we have already created the OBD under one and of one template. We trying to have a meeting with the TXT and then to see the way forward and finalize the template. Thank you so much.
Thanks, Din Jamal. So next update from Kenya, Dr. Reginald, you can go ahead.
Thank you, Putu. I think you had given a good summary about Kenya because you're working with us. But maybe the other detail that did not come out clearly is the getting the Ministry of Health to be involved in the project. Last week, we were supposed to have a meeting with the Nairobi Metropolitan Services Director of Health. They were busy with this second distribution of vaccine. But then he called me to say that he's given permission to Dr. Asma to work with us to make sure that the data stewards are trained. So what we want from him is just an official letter, but Dr. Asma normally is part of this meeting. Dr. Asma is in charge of the distribution of all the COVID vaccines in the whole of Nairobi County. And so we are going to touch base with her so that we can start moving forward. Thank you, Putu.
Thanks, Dr. Reginald. Because Professor Bernard is not here, so you can go ahead, Dr. Jeremiah. Dr.
Hello?
Jeremiah, you can go. Yeah, you can go ahead.
So currently in Tanzania, I think we're in the process of finishing up with with the template for putting in the data. I have a meeting with Alia this week that will be finishing up with a template which has been already prepared. Otherwise, everything is in place. Thank you.
Thanks, Dr. Jeremiah. And last update from Dr. Sakinat, but Dr. Sakinat is unable to update, so I will read the text in the chat box. So basically, from Nigeria, already created the template for OPD and share with Alia. And Dr. Sakinat also have 22. The team also 22 hospitals for this project in the list, and 6 has already been confirmed and ready, waiting for us to start. But Dr. Sakinat, can you give me information about two other hospital, because in my notes there are 4 hospitals. It is Federal University Lokoja, OOU, IBB Lapai University Clinic, and IBB Specialist Hospital. Maybe after this meeting you can contact me to inform the other 2 hospitals. Yes.
Yes, so like Dr. Sakina mentioned, there are actually 6 hospitals being worked on, and then 4 have confirmed. Then we are expecting the rest, because they have said the remaining 2 have said they need to be cleared from the Ministry of Health, which we are working towards that approval. But they are ready in terms of welcoming us, and because we've had meetings with them. But they said to go forward with our activities, we would need the Ministry of Health clearance. And we met the director yesterday. He had only asked us to give him this week also to meet the research committee for ethical clearance. Thank you.
Okay, thanks Abdullahi for the further information about the other 2 hospitals. And there is information from I think we agreed that yesterday, it is from Professor Miriam in the chat box, but I will explain it. I will repeat it. So we agreed yesterday that we will provide a draft letter that all country coordinators can use for health facilities, to use for the health facilities or in relation to Ministry of Health with VODAN. So do you want to comment about this, Professor Miriam, about the agreement of health facilities and VODAN?
No, I don't think so, but it was on the request of country coordinators. So Put and I will do this with Professor Francesca and this week. Abdullahi Kawu, if you need anything in relation to the ministry agreement, then also let us know. We have, of course, the experiences from the other countries, but of course you also know those coordinators, so maybe it's done directly, but any assistance needed, let us know.
Thanks, Professor Miriam. So we will move to the last session. It is update for the special issue. Misha, can you update about this? You can go ahead, Misha. Misha?
Hello?
Yes, I can hear you, Misha. You can go ahead.
Excellent. So we've made a lot of progress in the last week. We've sent 21 articles for the first issue that has been approved by Professor Feng Hong. And so what's going to happen now is we're going to conduct a double-blind peer review on all those 21 articles over the coming 2 months to make sure that they're up to scratch and give independent feedback on these articles. So that will be quite a process, which I'll explain in a minute. Maybe the first important thing to do is I'm going to show you a list of titles and articles that people will have to look at. I'm going to share it now, actually. And it would be good if everyone checks on the article whether the contact author is correct and whether the authors are correct and whether the titles are correct. We can't change the titles anymore, but yeah, just a minute. So that should be in the chat now. So if there's a mistake there, send it to me and I'll make sure that it gets corrected. If you're looking for the number of the article that you're used to, that's the hashtag O. And then the hashtag N is the new number of articles, so they've been reordered. Maybe I'll share my screen. So this is the new number of for all the articles. Some of them are different and have been moved up, and others have remained the same. So, for example, 12 has remained, but 36 has become 9, and so on. So, if you could please check this and send me if anything needs to be changed. Then for the double peer blind review, what we're going to do is all the articles are first going to be sent to Susan, as many have already been done for checking the article. So that's the main editing phase, and where all the main mistakes are taken out. Then most of these have already passed this phase, and so we will be starting the next phase, which is sending them back to Susan again to check that all the terminology is used in the same way. So VODAN is writing an article where on this terminology, which is becoming article number 2, and based on that article, we are going to send all the other articles, or all these ones, to Susan to make sure that the terminology is used in the same way. Once that is done, we're going to randomize the numbering of the articles, which will happen here. People won't have access to this document by then, and we will take all the names off, and we'll take the title of the article off, and anything that identifies who this article was written by, and we will send it to 2 different reviewers who will then completely independently look at the article and send it back to you or to me with all comments on what's good about the article and what's bad about the article and whether it's original. We are going to create a form which, with different criteria they have to look at for everyone to for everything to be looked at properly, and then so when that's back, I'm gonna get all the comments, so the authors won't be involved in that process, and I will consolidate all the articles and all the comments and send it back to you. And the idea is hopefully we can do this within a couple of weeks. Or one article can be. This process can be done in a couple of weeks, and then once I consolidated it and sent it to you, you have to look at all the comments, send it back, and then we'll send it to Susan one final time to make sure that the last edits are taken care of. When that's done, Professor van Rijzen will take a look at it and approve it for final upload, and then we will upload it to Feng Hong. And somewhere along those lines, we will also do a plagiarism check. Any questions? No? Yes?
Yeah. Is there any question or comment for this? I think it's a clear explanation, Misha. So thanks for that. So so that's the last session of VODAN Africa session today. But before I before close this meeting, is there any comment or question? So if it's not,
sorry, Putu,
yeah.
perhaps Professor Miriam would like to give some closing remarks. Generally, she has been providing lots of support. If she's still on the call, yeah, let me see.
I am.
Yes, Prof. We'd like to hear from you.
Thank you, Francesca. No, excellent work all along everywhere. Just really so happy. I put it in the chat, but I want to say it one more time. Thank you, Obina, for keeping us all on the horizon of everybody else and our funders. That newsletter yesterday was once again really excellent. And also, Francesca, thanks to you and Obina and many other people maybe for, we haven't really thanked you for it, for the renewed website. I don't know if people are looking at it, but it looks great, wonderful.
Yes, that's Oluwale. Oluwale worked on that.
Ah, there you go. Really great job with your team there, Professor Francesca. And those things matter a lot. You know, you can do a lot of good things, but if it doesn't look nice and if others outside your own circle don't know, then how can it grow? So all of that work, we don't every week report on its standard, but actually it's being followed up very, very well and very professionally. And really, thank you for that. Those are my closing words for today then, Prof.
Thank you very much, Prof. So I will hand over to Putu so that we can close just at the dot of the clock. Putu.
Okay, thanks, Professor Francisca. So I will close the meeting. So thanks everyone. As always, the video recording of the webinar will be available this week in every channels, such as websites like OSF and WhatsApp group. Thanks again for joining us. We will see you next week. Bye.
Bye, Putu. Thank you.
Bye, Professor Miriam. Thank you.
Bye, everyone.
Bye.
Bye. Bye, Maria. Bye, Putu.
Bye, Maria.